Good afternoon, everyone. Today's Battle Rhythm is being hosted by Jeanette Gillis. Jeanette is the Deputy Director of Community Integration. She's also the lead for America's Warrior Partnerships Network, which provides local veteran-serving organizations with a connection to natural resources when veterans' requests cannot be met locally. To find out more about the network, visit americaswarriorpartnership.org/the network. That's it for me, Jeanette. The floor is yours.
Thank you, Allison. Welcome to Bridging the Gap Between Military and Civilian Healthcare, our topic for this month's Battle Rhythm. I'd like to begin by welcoming all of our affiliate communities, 4-Star Alliance members, veteran service organizations, and guests. Welcome to our Battle Rhythm for today. Today, we're going to be joined by 4 fabulous presenters that are going to talk to us about military-civilian healthcare. We have Dr. Jennifer McDonald. She is the Chief Consultant to the Deputy Undersecretary for Health at the Veterans Health Administration. Ms. Jennifer Adams is the Executive Director for Network Management for the Office of Community Care at the Veterans Health Administration. Mr. Glenn Gray is the Director of Customer Care and Community Relations for Tri-West Healthcare Alliance, and Ms. Amanda Roberts is the VP and Program Manager for CCN Region 1 Optum. We're going to begin our discussion today with Dr. Jennifer McDonald. She's going to be talking about an overview of the Mission Act. Dr. McDonald, I'm going to turn the floor to you.
Thank you. Welcome, everyone. And first of all, thank you to America's Warrior Partnership for having us today. Ms. Jennifer Adams and I are really excited to be here. What we'll do today is Jennifer Adams will give a description of the Community Care Network and where we're going. I'll give just a brief overview and bring this together and describe the direction VA is headed in. We've seen since the beginning that there's been sometimes the Mission Act term has become synonymous with community care. And one of the important points to know is that the Mission Act itself is actually extremely broad. There are more than 50 sections within it, and it actually stretches all the way out through 2034. So while VA is about 60% through the way of implementing this, including with the new community care program, we still have a ways to go, and we're really excited about the opportunities this affords us to really shape the future of veteran care, and we believe lead as VA needs to in the ecosystem of US healthcare. Just want to touch on our core tenets and the way we've approached this. Really at the center of our approach to the Mission Act, as you've seen us approach COVID-19 and our response leading beside our federal government partners and our state partners and our local partners, at the center of everything we do has to be an excellent experience of care for veterans and their families and caregivers. And we do mean each of those. We understand certainly that veterans do not exist in their communities, often as individuals, but rely on family members, rely on caregivers to really be a part of their experience of care and a part of their health and care journey. And VA aims to put that at the center of everything we do, including with regard to community care. It's also very important to us, and you see in that second bullet, that VA is one integrated system with direct and community aspects of care delivery. Well, what do we mean by that? Certainly we have direct care through our facilities, in person in our facilities, and increasingly via telehealth during this time. And we certainly encourage that growth, and we're seeking to see that continue to exponentially rise as we come out of the pandemic and lead our way into the future. And of course, our network of community care providers, which is now more than 1.2 million. We see these as a unified national enterprise around the people we serve. So we want this not to be direct care in one aspect, telehealth in another aspect, community care in another, but really that this enterprise is woven together around the people we're serving and that this is a unified experience of care. And what you'll see us tackle over the coming year and the coming years is to really make sure that we've refined each element of that experience and that really we'd like this to be delightful at each aspect of the care journey. Whether a veteran chooses community care for a certain aspect of their care, whether they're choosing direct care or telehealth, and finding the right balance across the system that matters to them and their family and their caregivers, we want to make sure that the system really unifies around them and delivers the best experience possible. The Mission Act really has strengthened both aspects of care delivery and gives us better ability to empower veterans with that ability to find the right balance of care and their right options. It has given us, for instance, anywhere to anywhere telehealth. And this is one of those areas where the Mission Act itself is much broader than the community care program specifically. It gave us the authorities to implement this new community care program and streamline our approach and make this a better experience for veterans themselves and a better interaction with our community care providers to partner with exceptional partners like TriWest and Optum. And it also gave us that anywhere to anywhere capability such that we can take the expertise of, for instance, a seizure specialist who might exist in one of our large urban areas and bring that to a rural community where that expertise might otherwise not be available and where a veteran might otherwise have to drive to seek that care. We're able to really unify the enterprise again around the people we're serving. And the last aspect of this is that we are growing into really an optimized, customer-centric, what we call a high-performing network. That means integrating those aspects I've already mentioned, and that means finding the best of the best community providers to participate with us and really making sure that we share knowledge across our enterprise. Part of the Mission Act is allowing VA in our direct care system to recruit and retain excellent providers, and it gives us new abilities and new authorities to do that. It also allows us and really encourages us to share knowledge on things specific like PTSD with our community providers. And at this point, VA has made all of our training that we provide for our own employees available to our community providers as well. So we're really strengthening ourselves and unifying, as I was mentioning, in order to deliver a really excellent experience of care, no matter the balance and the place of care that a veteran may choose. These are a few elements of the Mission Act itself. You'll notice the caregiver program here. You'll notice the infrastructure or the Air Commission work, that is the asset and infrastructure review work that is forthcoming. You'll see VA start to take action on that in the near term. You see anywhere to anywhere telehealth here, and also that the Mission Act strengthened our ability to create innovation in our system and really advance that across the national enterprise. This goes to what Jennifer was referencing. It is simply our urgent care signage in the community. Veterans do not need a referral or an authorization from VA to be able to seek urgent care in the community for those community providers that participate with us in this fashion. And this sign, English and Spanish, is one of those that veterans would be able to see. And they would simply need to communicate to that urgent care provider that they are a veteran and would like to choose to use their VA benefits to access that urgent care facility. Just one more note on our virtual care growth. Indeed, across the pandemic, we have seen this increase exponentially. VA is actually up more than 1,000%. Yes, 1,000% since the beginning of the pandemic in virtual care. And what we've seen, and I think this is important as you interact with veterans, what we've seen is that some of the stereotypes, if you will, of the past, that perhaps older veterans wouldn't be as interested, or there might not be as much access in some rural communities. We've overcome many of those hurdles and have even gone to the point of being able to distribute devices that are internet enabled to make sure that veterans can connect with VA and seek the care that they need. And we've actually seen in our older veteran population an immense hunger to engage in virtual care, and really a delight once people have tried this out and participated with us. For those veterans who, for instance, might have mobility issues or struggle or rely upon a son or a daughter or a caregiver to drive them to an in-person visit, being able to get that care that they need and bring the expertise to them in their own living room is really a delight and enables them to connect with their care in a way that we're seeing really benefit people's lives and really bring the care experience together around them. And so we're looking forward to continuing to see this grow. And we would invite you to encourage that alongside us. And just one more note, and I'll close and look forward to your questions. And that is that as the pandemic continues, we have heard the altruism from the veteran community that I know well as an Army veteran myself, engaging the veterans that I served beside. Some of them say, you know, I want to save the care spots for those who really need it. I'm doing okay right now. And we really would like to invite you to encourage beside us that VA has capacity to serve veterans, and we would invite people to come in and seek the care that they need, especially during this pandemic. We have our direct care system, we have our community care system, we have telehealth. There are ways that we can meet these needs, and we don't want people to wait. We want them to seek the care with us that they need, and would very much invite you to encourage that alongside us. And with that, Jennifer Adams will give a description of the Community Care Network and where we're going.
So hello, everyone. I'm going to provide just a quick overview of the community care program within the Veterans Affairs. So as we look at the community care program, a lot of people are not really aware of the history of the community care program. So we've provided a timeline of community care and where did community care really start in the VA. And the community care program starts all the way back in 1945. When we were beginning to collaborate with community providers through agreements with each individual VA medical center. Over time, that program has progressed through relationships with our academic teaching affiliates, relationships with the Department of Defense. We've had several pilot projects. Some may be familiar with our Project Hero, which was a pilot program to improve managed strategies. Through our Indian Health and Tribal Health Services partnerships, to contracts that were available through PC3, our patient-centered community care contracts, national dialysis contracts in 2013. And then as 2014 rolled around and we had the choice program move into legislation, plans to consolidate the community care program. So as you can see over history, we had a variety of programs with the community care office that had varying degrees of eligibility, varying degrees of reimbursement that really created a lot of confusion for not only the providers in our community, but veterans and organizations that are helping our veterans navigate the process. So in 2015, we pulled together a consolidation plan that was submitted to Congress to consolidate these programs into a single plan. And in 2018, we actually had the Mission Act that was passed. But from the Mission Act, we had already started working on how do we consolidate our contract to develop the Community Care Network. And the Community Care Network is where we are today with implementation across the country of the Community Care Network. So our Community Care Network is a set of region-based contracts that provide healthcare services through a contractor who builds and credentials the associated network and processes our claims. So as you look across the country, we have 6 regional-based contracts. Regions 1, 2, and 3 have been awarded to Optum. Regions 4 and 5 have been awarded to TriWest. Regions 1 through 4 are fully deployed. Region 5, which is Alaska, is currently going through deployment. And Region 6, which is our Pacific Islands, have not yet been awarded and are still in the procurement phase. And as we talk through what the contract looks like, we've tried to make all of the contracts be consistent and seamless across the country so that you have a single consistent program, regardless of where the veterans are across the United States. So what are some of the highlights from the Community Care Network? This is our primary provider network. It does require referrals from your VA provider. There are a few limited exceptions where a referral is not provided. It is in use at all facilities within regions 1 through 4. It expands access through telehealth options in both CCN and PC3. So where we are in deployment in regions 5 and 6, we are still leveraging our PC3 contract. Just for awareness, there were approximately 500,000 telehealth visits under CCN from October to December, serving approximately 145,000 veterans. Transplant coverage is available in CCN regions 1 through 4. We do have an aggressive flu shot program to provide convenient access at more than 60,000 locations. In 2020, we delivered approximately 152,000 flu shots to veterans. Urgent care is an example of where there is no referral required to receive care in an in-network urgent care facility. Urgent care services are currently available through CCN in regions 1 through 4. There were approximately 493,000 urgent care visits in the community from June through December 2020. What are our efforts to continue care coordination with our community providers? So we have digital requests for community care to providers through HSRM. HSRM is our referral management system. It is a secure web-based system that shares the referral from the VA provider to the community care provider. It includes bundled care, or what we refer to as a SEOC, which is a standardized episode of care, which contains the details for the care that is being referred to the provider within the community. There are options for community providers to request additional or continued care for veterans. So if the care initially issued or authorized by the VA on a SEOC has additional services or needs to extend longer than the period that is initially authorized, there is a request for service form that community providers have available to use to request those additional services. HSRM does allow for a seamless exchange of electronic health records. So HSRM does allow for a bi-directional exchange of health information. We also make available through the Community Care Network the availability to share information through the Veterans Health Information Exchange. We also have information available through viewing within the provider's own EHR system. And there's a link provided for additional information for providers who are willing to or interested in signing up for health information exchange within the VA. We do have sharing patient record flags with community providers. So PRFs, that is a area where we are collaborating with workplace violence prevention programs, suicide prevention programs, and Cerner to develop guidance and facilitate system updates to communicate certain flags for disruptive behavior and high suicide risk, to share that information with our community providers. We have been able to pull together a lot of information on our community care and Mission Act resources. So this particular slide gives you general information and links so you can find more information around the community care program. The eligibility section provides you information around eligibility and who is eligible for the community care program. We also have a specific section on appointments and how to get care. If you're a provider and you're looking for information around billing and payments, we've provided specific links that are available for you to get additional information. And we also have additional information on urgent care benefit and how to access that urgent care benefit. And then on the far right side, we have very specific information around other aspects of the program concerning veteran care agreements, opioid safety, emergency care, and then the sunset of the choice program. So if any questions can't be answered here, we also have contact us information associated with this particular website where you can reach out and ask your questions to specific individuals within the VA. So I think that is all.
Thank you, Jennifer Adams, for that excellent description of the Community Care Network and where we're going. And with that, again, we're grateful to America's Warrior Partnership for having us here. And I look forward to your questions.
Thank you so much for that wonderful presentation, both of you. The next person we have up is our subject matter expert, Glenn Gray. Glenn is the Director of Customer Care and Community Relations at TriWest Healthcare. Glenn?
Thank you. Well, again, Glenn Gray with TriWest. Pleasure to be here. I want to thank Jim Lorraine and Jeanette and Allison, the whole AWP team, for what you do in bringing these community groups together. We've been proud to support you for the last few years. And again, as I was sharing with some folks earlier, to me, what's great about this group is having the ability to connect with all of you, share with you information that helps you better support the veterans in your communities. So thank you again for this opportunity. Just want to give a high-level overview about TriWest for those that are not familiar with us. We've been around since mid-90s. We're actually founded specifically to focus on the TRICARE program under DOD. So we had our first contract back in 1995. Again, worked through TRICARE for about 17 years, and then actually initiated our effort with VA in 2013, led into some work with the CHOICE program, and then back in 2019, we were actually asked to expand our area from the western part of the United States to the entire country, while the process of going to these new contracts that were just discussed by Dr. McDonald and Ms. Adams were discussed. So we actually had a national focus from 2019, and then last year started shifting back, pulling back some of that support. We are continuing to work some support throughout the country, and I'll talk about that in a little bit here in a minute. But again, look forward to working with Optum as well as we finalize those transitions of care. And then again, we are going live, have been live in regions 1 through 4. We are starting the process for region 5, and we'll be implementing that here in the next couple of months. This just gives you an idea of the space that we're talking about. Again, everything from Texas, Colorado, Wyoming, and Montana to as far west as Hawaii and Alaska. Obviously some unique territory, especially when it comes to healthcare. Some of the most rural parts of the United States that you will find. But fortunately, we've had longstanding relationship with a number of different organizations to support us through that effort over the last several years. And we'll talk about that a little bit here as well. So just some background numbers. Again, we've been supporting VA since 2013, supporting in a number of different roles. I think first and foremost, and what we continue to support through the CCN effort is the building of a provider network in the community to meet those needs when VA is seeking that care outside of the VA system. We originally had, and I'll show you a slide here in a minute that shows you kind of the growth. We did have a network up to 700,000 providers across the country. We have scaled that back because we're now focused on region 4 and 5. But again, built that network was a real key piece to the ability to meet that need over the last couple of years in particular. As you can see, we've worked a number of appointments, over 10.8 million appointments to providers in the community, as well as over 34 million total appointments. So that would be initial care and then the follow-up care over that time. A lot of care over the last several years. And again, we processed over 37 million, close to 38 million claims to date. And again, we understand the importance of providers. If we want providers in the network, they need to get paid for those services in a timely fashion, and that's been a focus of ours for a good period of time. Last piece I just wanted to highlight too is something that for my area is of particular interest and concern, which is ART IVF. So it's supporting veteran couples who are eligible for in vitro fertilization. Has been something that's been available now since about the last 3.5 years. Very proud of the work that we've done in this area with over 550 veteran couples across the country to enable them to seek that care in the community once approved by VA. And again, it's probably one of the things we're most proud of over the last couple of years in supporting that effort. Thanks. So again, a couple of things. I mentioned PC3. This is the Patient-Centered Community Care Program. And that is the vessel, if you will, that has been under the Mission Act between the CHOICE program and then into CCN, been covering a lot of that care. So we are changing again to CCN. And as was mentioned, the majority of all the appointment scheduling is now happening through VA under CCN. So we've transitioned there. We are doing some work in that area, and I'll talk about that in a moment. But a lot of that effort has shifted over. And one of the things we've worked hard with VA and the VAMC staff in particular is to help with that outreach to community providers so that they understand the connectivity, how to build those relationships with those providers, which is a key piece to the success of that effort. Additionally, VA is handling, again, most of that veteran customer service, so the contact center operations. We are maintaining a contact center operation for the existing PC3 care. So again, we still have some veterans who have authorizations for care that end at the end of March. So we continue to work and support that effort and the claims and things of that nature. But we've also set up a multidisciplinary contact center just to support the CCN side, primarily with the veteran support, but also with VA and any questions that may come through as well. Some of the new services, again, that are now covered under CCN, as I think was mentioned, got certain services like dental, unskilled home health, and dialysis. These are new benefits, great benefits for veterans to have access to. And for us to be able to support that effort through community providers is something we're very proud of. And then the contract modification, again, talked about that scheduling. A lot of that scheduling, again, will be done within the VA system. We have been asked in a few areas to help support on some of the low complexity care. And again, have been doing that over the last couple of months now. And we'll continue to support however we can in that effort. Again, speaking about our network, we had built a national effort, again, to meet that need. And as you can see from the graph on the right, we were at an area covering just the Western United States where we had a network to meet that demand and need. It grew very quickly over the course of a few months in order to meet that national demand to get over to that 700,000 mark and close to 1.4, 1.5 million locations to support that need. But again, because of this transition out, we're scaling that network down. We're actually creating new contracts for CCN, have contracted over 210,000 providers in order to meet that need for CCN Region 4, and are continuing to expand that network for Region 5. Additionally, I know Dr. McDonald spoke as well about the effort of bringing those providers on from PC3 to CCN. Again, we've got over 92% of those providers converted. Continue to work on that effort to bring more of those providers in. And again, this will be an ongoing effort with VA, with those local VA medical centers, with the VISN leadership to identify any additional needs. We recognize, especially with COVID and the changes, this is always fluctuating, and we continue to maintain those communications with the VA facilities to know where their need may be in the community that we can assist with. Just spoke briefly about Urgent Care Network, and again, our services were national. We did transition some of those efforts over to Optum last year, and then transitioned that effort into the CCN network for Region 4 last September. Should not have been a major change or identification for veterans, but obviously focused on making that transition over. About 95% of the veterans in the region, and that map gives you kind of a high level view, but with the focus of getting access to care within 30 minutes of their home, about 95% of those veterans have access to an urgent care facility in their area. And right now we've got over 3,100 urgent care facilities within Region 4. Continue to work that effort there, and obviously we'll be focused on Region 5 as well. Last piece I want to talk about just briefly is communications. Again, I think as it was mentioned, a lot of the communication moving forward with veterans, so those you're supporting, is really the VA's lead to handle. We are supporting with really more a focus on the provider side and the provider education. But did want to make a point, a couple of items. First of all, we do have a veteran portal on our website at www.triwest.com, which enables them to access information similar to they would find on some of the VA systems as well. But again, it's another avenue. If you've got veterans that are looking to have more connectivity to their information on authorizations and the like, they can certainly go to that website and then set up for access to the portal for that information. But we're really focused on our communications again with providers, those who are supporting that effort. As was mentioned earlier, flu shots were a big focus last fall as those flu shots became available. Continue to do a lot of education for providers, especially on claims, timely filing, reconsideration. Again, we have a number of providers who are transitioning from PC3 to CCN. And if they've got any claims that they have yet to submit, we're really encouraging them to get that done as soon as possible in order to meet those claims processing needs. And then again, a lot of focus on COVID-19, the pandemic, and communications out to our network about any of those changes. And the last but not least, we certainly stay in touch with a lot of the veteran service organizations, provide updates and communications. AWP certainly falls into that avenue as well. So we will continue to connect with Jeanette and the rest of the team. Anytime we have information that we can share with all you, we're happy to do that. So I think that is my last slide. Again, appreciate the time to be with you. Look forward to answering any questions you have today.
Thank you so much, Glenn. For those of you who are wondering about questions, please feel free to add those to the chat box. And at the end of our series of presentations, we'll be opening the floor up for a question and answer session. So keep the questions coming and we will get to them after Amanda's presentation. Our next presenter is Amanda Roberts. Amanda is the VP of OptumServe Community Care Services. She is the program manager for CCN Region 1, and she's going to talk to us today about Optum. Amanda, I'll turn it over to you.
Thank you so much. I want to start on the first slide here with a little bit about Optum as an organization. So if you go to the next slide where you see kind of our layout of United Health Group, Optum does fall under the larger United Health Group umbrella. And so you can see here that what that really has been allowed us to do is to integrate the services of our larger United Health Group family, specifically called out there United Healthcare, to really provide the Veterans Health Administration under the CCN contract a federal solution that's really aligned with some of the private and public sector practices, so we can bring with it some of those best practices. As you look specifically on the next slide at the community care network, you saw Glenn's presentation and the grayed out section of the map. That is Optum. That is CCN regions 1 through 3, where Optum has responsibility. You can see that's as broad as the northeast section of the map, as well as, you know, more of the rural Midwest there in the middle under region 2. Within the regions, we've really worked to establish a high quality, high performing network. Ms. Adams called out credentialing, and so that's a component of our high quality network. And as Dr. McDonald was talking to, really optimizing and supplementing the great care that's provided within the VA medical centers to provide a network for VA to supplement that care. We also focus on the experience. That's really been what has driven our solution, the experience of the veteran, the provider, as well as the VA staff member, who under CCN has a large component of getting veterans that care. And that's really been important and really the foundational element of our solution. So as we go to the next slide to look at the solution under CCN and Optum, I think it's important to realize that, you know, there's 5 items on the slide, but it's really 3 areas of focus for us at Optum. The first one being the provider network. As Glenn mentioned with TriWest, this network includes not only healthcare services, where we were able to leverage United Healthcare and then build upon that base, but also services such as pharmacy care that are received through the larger CVS Caremark network, a complementary and integrative health services network, and then dental through our partners at OptumServe Health Services, formerly LHI. The second component is really claims processing. Much like TriWest mentioned, it's very important that as you build a network, that you process and pay those claims so that you can keep those providers in network. And so later in the presentation, I'll talk to how Optum's doing in that arena. And we have partnered with PGBA, our subcontractor for claims processing. The third component are those areas in the middle. That's really where our community care experience team, our contact center, and then our portals come into play. So our community care experience team is a group of individuals aligned to each of the regions, further broken out to align one per VISN or the integrated service networks of the VA, to really give the VA staff a single point should they have items that they need to escalate, questions about the network, or really just those questions that can get sometimes complex when you're dealing with healthcare. And so we have a community care experience, veteran experience officer, or VEO as we call them, available to each of the VISNs within our region. We also have our contact center. So this is your basic questions, your incoming items, where if you're a provider or a VA staff member, that can serve as kind of that first place to go to get your answers and the solution that you need. And so we offer this both for VA and providers, and both in the form of a telephone call or an interactive immediate chat notification feature. And then last is really the VA veteran and provider portals. So these really serve as both our place to get education. You can receive education materials, provider updates, awareness of new happenings in the program. And that's there at vacommunitycare.com. And so really kind of that one platform. Your veterans, if you're helping them in this pathway, you can see their EOBs, see the referrals that they have. So really that one stop where they can see that information about their care in the community. And then when you look at this, you can see that the network originally was made up of those health services. We've had some additional items added to our contract since go live. And what you can see on the next slide here is some of those benefits expansion. These may be really complex services that had stayed a little bit longer or weren't part of our base agreement and have since been added. So you'll see the first one there is transplant services. This was added to CCN in September. We are currently leveraging the ability to utilize single case agreements so that veterans' care for transplant services isn't delayed, as well as we currently have 22 contracted transplant providers in network throughout the 3 regions, with that growing each and every month. The second service is really the ART and IVF services. Glenn spoke about this and really the care and the ability to give this a little bit of white glove treatment to allow those veterans that are eligible for this service to receive assistance in the community. These were most recently added to our contract in November, and we have had since that time greater than 200 referrals for the service received. The next service, again, when you look at really the solution of CCN and you look at the next slide, the solution really included the VA owning the relationship with the veteran and utilizing our integrated platforms of providers to make those appointments. We are in the process of engaging with the VA on assisting them with appointment scheduling support. You can see that the go live for that is planned for February 10th. some tentative deployment planning there at the bottom of the slide as we continue to help them with that scheduling. And our solution includes not only scheduling the initial appointment, but also sending the veteran the reminder, a confirmation that care was received, and then assisting if there's any follow-up actions needed from that appointment that we can help to service our veterans with. So my last slide really talks about kind of how far we've come. So if you look at NCCN for regions 1, 2, and 3, we are servicing more than 109 medical centers, including their more than 300 CBOCs. And really, you know, the big factor here is that we've been able to support over 6 million veterans, really, you know, adding to their care experience. We have a provider network that is just under 889,000 providers. And really, it includes 94% of VA priority providers, as well as 96% of their academic affiliates, those that VA does and has current relationships with and has had for quite a while. You can also see that we have adjudicated more than 8.88 million claims, and really doing that in a timely process with adjudication being 11.7 days on average. In addition to community care under referrals, which have been more than 2.6, there's also the urgent care component like TriWest, that we have had more than 137,000 visits on, even during our go live in the middle of the pandemic in March for Region 1, and then later in September for Regions 2 and 3. And then the last thing is our VA Nurse Advice Line. So this is a feature under our broader Optum community care services, but it's really allowed us to further assist VA in handling increased call volumes that may be due to questions as it arises or veterans needing care. So all in all, rounding out to, you know, support throughout the regions and throughout VA, as Dr. McDonald pointed out, just to enhance that veteran care experience. So Optum is happy to partner and welcome your questions.
Thank you, Amanda, and thank you to all my presenters. I'm going to go ahead and open up for questions. And I think the first question is for Jennifer Adams. It says, is there a list of VA authorized urgent care providers by location? Would that be found on the website, Jennifer?
Yes, you can go to va.gov, and there is a provider locator tool available on va.gov so that you can search by location to determine where your available in-network providers are.
Excellent, excellent. Some of the other ones had for who to find out who is the contact for the Mission Act. So Jennifer McDonald, who would be the contact for the Mission Act and by location? Would there be, Jude is asking about for Alaska, but I'm sure other people would like to know as well.
Yes, and actually I'm going to pass that to Ms. Adams because if that's in reference to using community care abilities under the Mission Act, then the community care office would be the right place. And Jennifer, I know you all have a list of points of contact by region.
Yes, so if you're looking specifically for the community care office within the medical center, I can follow up and get you that specific name. I don't have the Alaska one pulled up in front of me right now. If you're wanting the specific Office of Community Care, Region 5 point of contact, that would be Amanda Villa. So if we can get a little more information about what you're looking for on the Mission Act, then I can get you to that right POC so you don't get bounced around a few times.
Man, that sounds excellent. I'll make sure you get that information, Ms. Adams. Let's see, Glenn, how about you can answer this question? John says he's in Region 5. How do you become a community partner? He works for an acute mental health hospital.
Right, and I saw your message, John. Be happy to connect with you afterwards and get you in touch with one of our provider contracting representatives. So again, we cover Wyoming. And again, behavioral health or other, we're certainly open to contacting providers who are interested. So again, if you have an interest, I can either connect with you afterwards, or I can give you my email address and you can reach out as well. But we'd be happy to have someone make contact with you.
Oh, thank you for that. I was pulling up some more questions that we had that came in on our survey. Some information about how does one become a healthcare partner or provider? What would be the best way to go about that?
I'm not muted, so I'll say again, if it's a provider, again, based on the region. So both of our websites I know have information specific to making contact with providers. So if you're a provider and you're interested, you can go to our website. We have a section on how to become a provider within the network, steps you'll have to take through that process. And again, I'm sure Amanda's got the same thing there. And John, to your point, my email address is just ggray, GGRAY @triwest.com.
Dr. McDonald, maybe you can answer this one. What new resources are trending for veterans?
Well, several, and I would say certainly we're seeing veterans really exercise the use of all the options they have available to them, including new services in our direct care system, our new caregivers program, for instance, and the broader community networks that we have now. But above all, I would say that telehealth is the new opportunity that we are seeing used by far the most. Veterans can get primary care, mental health in the privacy of their own living room, specialty care. They can call us with an urgent care concern and spin up a video visit before they even have to take a foot out the door. And so we're really seeing that continue to grow, and it's something we're certainly encouraging, especially during the pandemic, but we believe it'll continue to grow even past that. And so we'd be happy to provide some more information to this group to help veterans get started if indeed there's interest.
Cool, thank you. Since you mentioned healthcare, there was another person that said outlook on pain management for healthcare. I'm not sure exactly what they meant, but that's what they were interested in finding out more about.
Yes, and actually, so you've seen VA over the last few years lean very far forward to make sure that we're really at the leading edge of pain management, and that's in reference to opioids and controlled medications, but also more globally. We know that given the unique experience veterans have from their time in service, that pain control and pain management can be significant issues that the people we serve face. And so VA has really leaned forward to do a number of things to make sure that we're really the best in class managers of opioid and controlled prescriptions, but also that we're really stepping up our ability to offer complementary and alternative care in terms of pain management. We have seen our virtual Tai Chi network, for instance, grow like wildfire. And we're seeing a number of other opportunities through complementary and alternative pain management that moves people to a healthier lifestyle and away from opioids while still making sure that their pain is managed and making sure that they have access to any mental health care they may need as they go through that endeavor. We're really looking forward to even further integration of our primary care and mental health services as well. Again, the theme here, which you've heard me say many times today, is we're really unifying our enterprise around the people we serve. So when it comes to pain management, we don't want veterans to have to go from one provider to the next to manage a series of different appointments, but rather have the care tailored around them. And that's what we believe is at the core of some of the success you're seeing. We believe we're really leading the way in US healthcare from a pain management perspective. And the last thing I'll note on that is that we've actually just rolled out a new technology that helps us connect to databases in states securely, such that if veterans are receiving opioid or controlled prescriptions elsewhere, we can collectively manage that and make sure that we're keeping them safe and make sure that our providers have the right information in front of them to make good decisions. So we're looking forward to future steps on this, but we really intend to continue to lead the way in US healthcare on that one.
Thanks for that. It's funny you should say the Tai Chi, because another question was the trends and support for alternative therapies such as outdoors, equine, and recreation. And Tai Chi would definitely go into that one, like you just talked about.
Yes.
There was one there was from Alexandria said the gap we've been dealing with lately is regard to recent separated veterans who have served less than 2 years and are not rate for TAMP, general discharge, VA care, other mill, or TRICARE. Any recommendation on health care for those veterans as they go through their transition from military to civilian life?
Yes, and thank you so much for raising this. That transition is a critically important time. We know that the year someone comes home from deployment and the year following someone retiring or discharging from the military is exceptionally high risk as veterans transition into civilian life, exceptionally high risk from a mental health perspective, and also can be from a physical health perspective. And we very much encourage, and in fact, we do a lot of outreach on this front in VA and a lot of reach into the DoD side of the house to make sure that we're bringing veterans across that transition phase. But we really encourage people to enroll with us, to explore the options that they have with us, and really to seek out that first primary care or mental health appointment that will bring them into our system and really sort of open the world of other possibilities and benefits that are available to them. And we would be happy to provide further information on that as well. We think that's especially important during this pandemic, during this time when even normal circumstances can be further complicated by isolation and by the social norms that are just simply disrupted across the country and the globe right now. And so really happy that you brought this up, and we'd be happy to provide you more information on the easiest way for veterans to make that first appointment with us, that first touch point that can lead to broader care.
Thank you. Thank you. We had questions about strategies for veterans in rural areas. Would anybody like to have at that?
Yes, and I will pass the baton in a moment here because I know this has been under very active work with the Office of Community Care and with Optum and TriWest to make sure that really we have a robust network everywhere we go. VA's philosophy on this front is that it shouldn't matter where you live. We are aiming as we move through the next few years to partner with the FCC, to partner with DoD, to partner across the federal government and with state governments and local entities, even private sector providers, as you're seeing us do now, to make sure that people have access to in-person care in rural areas and also that they have the connectedness to digital care, to telehealth options that we know is an essential part of healthcare moving forward. We want to be able to bring expertise from anywhere in the country to anywhere a veteran chooses to live. That's our philosophy. We are well on our way there, and we are specifically targeting programs for rural areas such that we are really optimizing the direct care system, the community care partnerships in that area, strategic partnerships. You'll even see us partnering with people like T-Mobile or AT&T to bring free digital access to VA healthcare locally, and really using all the tools in our tool belt to make sure that we're meeting people where they are instead of expecting them to come to where our facilities have traditionally been located.
That kind of plays into, somebody asked what the biggest challenge or obstacles to overcome are that you see in trends. Would you say it's probably the pandemic and not being able to see people face to face, or more of the rural?
Would say both of those actually. And the one I'll note especially is that VA is really in a time of transformation. This started prior to the pandemic, but certainly we have purposefully accelerated it across the pandemic. And really, I would say the biggest challenge in front of us is really designing a healthcare system that even with the results of this pandemic and the impacts that it's had, that a healthcare system that will meet the needs of veterans who are moving to different geographic locations in the country, who are accessing healthcare differently, who have different injuries than previously did from service, that we're really designing a healthcare system that will continue to meet their needs across the next decade and beyond. And as you'll see as we proceed into the Asset and Infrastructure Review Commission, really that's an opportunity for us to redefine our markets in VA, redefine the areas and regions where we serve, and really optimize the healthcare resources in those areas. And we want to match that up exactly to veteran needs in those areas. This isn't about moving buildings or changing what people have known and been familiar with, but rather making sure that all of our resources go directly towards the needs that we know veterans have in those markets. And that, again, we're using all the tools in our tool belt, our direct care system, our community care providers, telehealth, our strategic partners, including telecom companies like the ones I've referenced, and really making sure that we meet needs across the coming decade and beyond. And so really at the core of that is VA is transforming and modernizing, and we want to be the leader out at the front, out at the cutting edge of US healthcare, such that veterans are getting the best care out there, no matter where they choose to live. That is the core challenge in front of us, but we see it as an opportunity. And frankly, it gets us out of bed in the morning, and we find it extremely compelling.
Yes, I mean, go ahead. Jennifer, you were about to say something a minute ago about rural veterans, and I was interested to hear what you were going to add. Sorry.
Yep. I was just going to add that we leverage our partnership both with Optum and TriWest to identify those needs through very close interaction with those organizations and our VANCs and our VISNs to understand in greater detail what those needs are of the veterans. So we have monthly and quarterly meetings to understand what those veteran needs are so that we are more prepared to react to those needs in a go forward basis rather than having to react after something has occurred. So I don't know if Optum and TriWest want to jump in on some of the activities that we do in conjunction with our boots on the ground in those locations in the rural areas to be prepared for what those upcoming needs are going to look like.
Yeah, I can start for Optum. So one of the things that we've really done is start with what we call network optimization. Region 1's been live just a little bit longer. So we started it in Maine, which is a pretty good mix of both rural and some urban areas. And so there we really looked at the services that VA is providing and how we can supplement those. And if there's any outside the box thinking that we can come into play for some of these rural markets, whether that maybe is a mobile health clinic or some other service that is needed so that we can collaboratively work together to understand those specific geographies. We're then moving state by state to really make sure that our network isn't just a total number of providers, but it's really optimized to complement what VA is providing.
I'd echo exactly what Amanda just said. I think obviously the pandemic has had to change a lot of our perspectives quickly. We were in the process of doing this transition for CCN just as all of this started up. And it's a credit to, I think, both VA and to those of us who were making that transition, knowing that there was a minor delay in getting that process started in the midst of everything that was going on. As we're in the process of trying to contract with providers to have communications, a lot of those provider offices were empty. You know, they had no staff there. They were closed down. Making contact with those providers is a much better situation now and has been the last few months. But I think we've also had to learn, again, how to communicate with providers in a different way. And again, as we're spending so much time online on these communications, we're really having to learn how to pivot, again, whether it be rural or urban, is to how to best maintain that communication. And again, I think I saw somebody's note come across. Clear and consistent communication is really one of our focal points right now as we go through this process. And again, focused on the online care options and that. So again, I think we can't communicate enough about this. And again, having an opportunity like this to share this with you helps you share both with veterans and providers in your community. So again, I think we're continuing that effort. And again, we'll continue to jump as we need to meet the new demands that come across.
Excellent. Thank you guys, you all for that. There was a question too about, I know we've talked a lot about reaching people through video, but how are you capturing the aging veteran that isn't necessarily going to be connecting on a virtual platform? Is there any kind of tricks or what's up? What have you been using for that?
Yes, and we know that even as I said earlier, that a lot of our older veterans are becoming really comfortable with telehealth and really enjoying that once they've tried it out once. We also know that some of our veterans, those who are older and also some who are more familiar with what their traditional access has been in rural areas, are more comfortable by phone. And we've actually seen our telephone care rise exponentially alongside our virtual care. Our PAC teams, our patient aligned care teams, are doing a tremendous amount of outreach by phone and really starting there and moving to video if indeed that veteran and family and caregiver have comfort level with that. And providing them the resources they need. But we're seeing a lot of this care conducted by telephone, and we're aiming for really a high degree of outreach and sort of a high touch invitation that welcomes people back into the system, even if to this question, even if their first touch point has been a long time ago. We know that during this time, during the pandemic, there might be renewed need. And so we've upped our outreach. We have also really made an effort to reach into state veterans homes. VA doesn't own the state veterans homes, the states do, but we've made a really proactive effort to partner with states and make sure that we're really aware of those veterans who are there, who are enrolled with us, and those who are not, and really proactively engaging them and making sure that they're safe. In fact, in state veterans homes and community nursing homes, VA has actually partnered with states at this point to assist with COVID-19, whether it be guiding them on infection control practices in a community nursing home, whether it be providing testing, providing PPE. We've actually been in 47 states and the District of Columbia, in addition to in tribal communities at this point. We're really proud of that. We're proud of the agility of the enterprise and what we believe are many lives saved such by our ability to partner alongside federal partners and states and really reach into those areas, especially for older veterans, where we know it's protective if we make a proactive move and if we're there ahead of seeing an actual need. So we've been grateful to be able to provide that across this time, and we're going to continue to conduct that outreach and really welcome people back in, even if it's been a while since that first touch point with us.
Well, that sounds exciting. It makes a lot of sense. So I really do appreciate, I think that's about all the questions that I have for you guys right now. I totally appreciate all your time you've given us today. Amanda and Glenn and Jennifer Adams and Dr. Jennifer McDonald, so appreciate you guys being here and being willing to share with the group here and answer all our questions. Jeanette, I'm going to go ahead and turn it back over to you, I believe.
All right. Well, I echo Allison's thanks. It was an honor to have the four of you with us today, and we certainly appreciate your time. And for our audience, we hope that you all got some good information and that it was a powerful and good time spent today. We would like to invite you to be at our Battle Rhythm next month. We're going to be coming together again on March 1st at 2 o'clock, and our focus will be educational support for veterans. We'll have Dr. Abby Hinch. She is the Vice President of Programs and Services for the Student Veterans of America, and Jesse Totsty, who is the Director of Outreach and Admissions for Warriors Scholar Project. So please join us next month when we are going to be learning from them about educational supports for veterans. And again, we would like to thank you for being with us here at America's Warrior Partnership, where we empower communities to empower veterans. We hope that this day provided you with powerful insights and best practices and new tools to partner. We will see you next month, and we hope you have a great rest of your day. Thank you so much.
Thanks, everyone.
Thanks all.
Thanks. Have a great day.
Thank you.